So an implantable loop recorder, or ILR, is a small device, smaller than the size of your little finger. And it's actually implanted on the inside superficially of your chest, just here typically, where it can sit for a period of between 3 or 4 years, continuously recording the data from your heart to understand the reason why you might have a loss of consciousness or fainting episode or palpitations. An implantable loop recorder is a device that has a battery and has a sensing electrode. So the pair of sensing electrodes that it has starts to record your electrocardiogram, or the electrical signal that arises from within your heart on a continuous basis. And it does so automatically and continuously throughout the time it's implanted for. Now, typically, the loop recorder is able to automatically detect any dangerous fast or slow heart rhythms that may lead to your symptoms. So your doctor may have referred you for an implantable loop recorder because of several reasons. The first is palpitations. And if you have particularly short-lived, infrequent palpitations that are otherwise difficult to capture on conventional Holter ECG recordings, which are typically run for 24, 48, or 72 hours, and sometimes a week. And if those recordings still do not identify palpitations because they are occurring too rarely and infrequently, then the only way we might be able to determine or diagnose the cause of your palpitations is to put this implantable loop recorder in. Now, the second reason for having your doctor refer you for a loop recorder implant is infrequent syncope or loss of consciousness. And if you're losing consciousness, but it doesn't occur frequently, for example, once every 3 or 4 months, then it may be more pragmatic to implant a loop recorder for the doctor to understand if there is a cardiac reason or a cardiac electrical rhythm reason why you might be losing consciousness on that infrequent basis. So choosing not to have an implantable loop recorder when your doctors recommend it will not make you come to harm. The loop recorder is purely a diagnostic device, and really when your doctor refers you for a loop recorder implant, it's to really ascertain what the cause of your symptoms are. Typically, for a loop recorder referral to be made, your symptoms are infrequent and short-lived, because these are the two conditions in which the conventional way to track your heart rhythm, for example with a 24-hour Holter monitor, will fail because you are not getting frequent enough or long enough duration episodes to be able to make a diagnosis. So when your doctor refers you for a loop recorder implant, it's in your best interest to understand that the reason for referral is actually to help you arrive at a diagnosis, to understand what is causing your symptoms to manifest on that infrequent, short-lived basis. So the implantable loop recorder, which we recognize as being a small device, smaller than the size of your little finger, is normally fed into an injectable device here, which is the introducer. And the implant is done by inserting this small plastic sharp introducer just inside of your skin under local anesthesia, and a plunger, or the aspect of the device that pushes the device through, and so the device comes out within your chest wall, and it's implanted like that, and so it sticks inside of your chest when the plunger is removed. So when you come to attend for your implant, and this is a dummy, which we have your neck, your right chest, your left chest. The area of interest is this area just to the left of your breastbone here. So this is your breastbone, and this is the area that we're going to insert the loop recorder. And the next thing we're going to do is actually pull over a dressing, which we will stick on you to keep things nice and sterile. And what you might experience is this sticky tape coming over, and we keep you nice and sterile like this in preparation for the implant. So once the local anesthesia is in and you're completely numb in the skin, the next step is to make a small incision into the area where we're going to insert the loop recorder. And with the knife now making an incision less than 1 centimeter wide, we now take the introducer, which is preloaded with the implantable loop recorder, and we insert this into the tract of local anesthesia. We spin it around, and Then we would use the plunger device to push through and insert and implant this loop recorder underneath the skin, like so. Taking the plunger out and then removing the introducer, what the nurse will do then is press firmly on the area of the incision and swab any bleeding. This process can last anywhere between 3 and 7 minutes, depending on how much bleeding and how long it takes to stop the bleeding. But at this stage, we're going to assume that the bleeding is stopped. And so the next stage now is for us to put the steri-strips, which are surgical plasters that we simply apply to bring the edges of the wound nicely together, like so. And we normally use 2 or 3 steri-strips, like so, to bring the edges of the wound entirely in close opposition before using a waterproof dressing, which is what we call Tegaderm. And this waterproof dressing is a transparent dressing that we can place on top of your steri-strips that will be able to allow some see-through. So it's a transparent dressing that is waterproof, and as we place it on top of the steri-strip, so the whole thing becomes waterproof, and you should be able to now shower, although not immerse yourself in a bath or swimming pool, but you should be able to shower with the waterproof dressing on top, and this will then be taken off or removed by yourself in 5 to 7 days. And that is how the dressing for the implantable loop recorder is put on, and that makes the end of the implant. So when you come to have a LINX implant, you will have a consent taken, and that means the team who are doing the implant will speak to you about the procedure, but also importantly let you learn more about some of the complications that may occur. Now, these are very rare, but the most common complications that we see are a risk of bruising or bleeding from the implant site. Now, the team are very good at minimizing your bleeding risk by essentially applying pressure on the site. And if you press on a bleeding site, you can almost always stop the bleeding. And the team who implant the device are very good at only closing your wound when the bleeding is stopped. So the first complication would be bleeding, and that occurs substantially in less than 1 in 200 patients. The other complications include infection, and this is something that is not immediately apparent after the device implant, but may come to start to show itself 3 to 5 days after the implant. And the typical signs of an implant infection would be acute pain or tenderness which does not resolve. Acute tenderness when you're pressing on the device, so if you're exquisitely sensitive with pain, or if the device implant site becomes hot or angry, or if you're discharging yellow greenish pus, it's a strong sign of infection. Again, it happens in less than 0.5% of the cases that we see, or 1 in 200. It's quite common, and I would say in probably 2% or 2 in 100 cases of patients will feel some discomfort after the implant, particularly in the first 6 to 12 hours as the local anesthetic wears away. But the way to counter this is just to take some simple analgesia, something like paracetamol, or if you're not allergic to, something like ibuprofen. Now, the last and quite uncommon complication of the implant is if the device itself starts to extrude or leave the site of implant from the wound opening. Now, this is incredibly rare, again less than 0.5%, but you might find that if the header or the head of the device starts to poke through the incision site, and you can actually look at the device or look at your skin and feel the device poking out, it's time to come back or call your local team, because it's almost certainly the case that we need to then explant it formally. And those are the major complications of having a device implant. So one other thing that could occur, which I don't consider a complication, is that as the device sits in your body and as the wound heals over, depending on the tissue underlying where the implant was inserted, there can be a bit of movement. And so the original site where you have felt the device go in can be a bit different from where the device lands up, and that's called device migration. Again, that's not really a complication, and particularly if you're comfortable with the location of the device that has moved somewhat and stabilized elsewhere, as long as we can still record a good signal from it, in most of the cases we can, then there's nothing to worry about. After you've had your implantable loop recorder inserted, typically the team will monitor you in hospital for approximately half an hour to ensure that there is no bleeding at the site, and after that you'll be good to go home. Now, that is the acute recovery. In the chronic recovery phase, which means what can you do afterwards when you get home, we typically ask you to avoid submerging the wound, which is no baths, no swimming for at least a week, because this is typically the time it takes for the wound to completely seal over and become waterproof on its own. Now, of course, we also give you typically a steri strip, which is a surgical plaster, and on top of this, we give you a waterproof dressing so you can shower from the same day or ideally the next day after the implant. Just let the water wash over the surgical waterproof dressing, and don't scratch at it and don't put any soap. It will just wash through and not affect the healing of the wound. Now, in terms of exercise, we would ask you not to do any upper body strength training for at least a week, because what we don't want to do is for the wound to start to flex or to start to move too much after being sealed by the surgical plaster. So for example, no bench presses or overhead raises, but you can of course go for a walk, and a brisk walk at that. These are the main principles of recovery. And the final thing to say is, if you have any pain, this should be a self-limiting pain that should resolve within 24 hours. And typically all you might need is a couple of doses of paracetamol. If the pain is getting worse and worse after day 2 and day 3, then you might need to suspect that you're getting an infection. And I would suggest getting in touch with the implant team. So in a majority of patients, the loop recorder will not feel like anything at all, because this is the size of the loop recorder. And if you have enough skin and we implant it inside of your chest wall, just underneath the skin, the size and thickness of this means that you might not even feel. So when you talk about what will it feel like, it might not feel like anything at all, apart from being able to notice a scar. Now, it's common though that if you were to press with your fingers very carefully on top of your chest, you probably will feel the outline of this device. It's hard, and you might be able to demarcate the outline. And certainly if you're very skinny with not much subcutaneous tissue or fat, then you might see a slight prominence or mound around the area of implant. In no way does this mean that it's gone wrong. In fact, it's very common as well in skinny people to see this slight mound, but very uncommon for people to be complaining about pain, because your body will simply get used to having this internal system. From the moment the loop recorder is implanted, it's already in use. And what it does is, whilst in your chest, it automatically and continuously records your beat-by-beat electrocardiogram, which are the electrical signals that are generated in your heart, and it's listening for and looking for periods of low heart rate, so-called bradycardia, or high heart rate, which are called tachycardia. And what it will do is it will automatically flag and record and store these episodes which are of interest to your clinical team. Now, the second way to use it is actually to use a wand, and this is a wand that you will be given to pair with your loop which is inside. And if you press the button next to the loop, you'll see a light flash, and that means you can store data at any time you feel symptoms, and this data can also be uploaded to your team. There are two ways in which the ILR device can connect to your healthcare team. The first is to use a device like this, and this is called a home monitoring system. And essentially you plug it in through a 3-point plug to your bedside, and there it stays. Now, if you're traveling, for example, you can bring this whole machine with you and just plug it in wherever you arrive. And this device has a SIM card, which is a data transmission card, that via Bluetooth will pick up your data from the implantable loop recorder every night and push it to the cloud so that it's available for your healthcare team. So the reason you might want to store data on the loop recorder is effectively to record abnormal heartbeats as a cause for your symptoms. The first thing to say is that this loop recorder Inside of this system, there's a battery, but there's also a brain which analyzes every single heartbeat coming into the system. And so there is an automatic detection of any slow heart rates, bradycardia, or rapid heart rates, tachycardia. And this will store a section of the data in this loop, which has a total of 40 minutes of continuous recording. And it will take away either 2 or 3 minutes of that loop to store until you can upload the data to your healthcare team. Now, in this instance, you might think you might not be concerned or worried about how to store the data because it does it automatically. But there are some instances where you might want to actively store the data yourself. Now, if you have one of these devices, which is a home monitor device by your bedside, you will be given a wand, which looks a bit like this. And this wand allows you to actively store data even if the device has not automatically stored it itself, which you might not be aware of. So for example, if you feel dizzy, or if you have palpitations, or if you lose consciousness, when you recover from that episode of loss of consciousness, you can take the wand and you can press it right next to the device. It will let out a light and it will store approximately 8 minutes of data retrospectively. That means before you click the button, it would store the 8 minutes of duration prior to that episode in order to capture what just happened for you. Now, why is this important? It's important because not every episode of loss of consciousness or sense of palpitations is automatically due to your heart. So some patients can have loss of consciousness from another reason, which is nothing to do with your heart. You could have head trauma, you could have had a fall because you tripped. And it's important in that situation that if you don't have any heart abnormalities that would otherwise be stored automatically, that you use the wand or your mobile phone, store that episode, so that when you speak to your healthcare team and you said, I fell on this particular time and day, when we look at the corroborating evidence on the stored electrocardiograms, we might not see any heart rhythm abnormalities which are too fast or too slow. In other words, your fall was not due to a heart rhythm abnormality. And this is also extremely useful and important for you to understand. When we talk about a home monitoring system, it essentially refers to the ability of your healthcare team to remotely monitor your device. And two ways of doing this. The first is the home recording system or the home monitoring system that sits by your bedside and automatically gets the data from your device every evening. The second way is through a mobile phone app that you've been invited to download to pair and connect with your device that will also transmit the data to the cloud for your healthcare team to read your data. It depends on the reason for your ILR implant. In most patients, if we are implanting the loop recorder to make a diagnosis of fainting or syncope or palpitations which occur rarely, then typically once we have clarity about the diagnosis, in other words, your ILR has demonstrated very clearly what the problem is and we have fixed the problem. So for example, if you're fainting and your heart stops and you need a pacemaker, and the pacemaker is now implanted to stop your heart from stopping, well then the ILR can come out as soon as the pacemaker is put in. In some other cases though, the ILR is going to be with you for a lot longer. And these are, for example, in cases where we don't really understand what's going on, even after the duration of the battery life of the ILR, because A, you haven't had enough events. You haven't fainted since the ILR was put in, or you have not had any palpitations since the ILR was put in. In that instance, your healthcare team will need to make a decision as to whether to take the ILR out after a period of 3 or 4 years, depending on the life of the battery of the ILR, or to implant a new one at the time of battery expiration. The short answer is no. With an implantable loop recorder, this small device inside of your chest, you can have any medical investigations, and that includes a mammogram and an MRI scan. What I would say is if you're going to attend for an MRI scan or mammogram, please wait for at least 6 weeks for the wound to close and for the device to be stable and attached to the internal ligaments and muscles and fat around the inside of the skin where it's implanted. Beyond that, if you are having an MRI, please make sure to inform your MRI radiologist or the doctor who has referred you for that MRI It is safe, and what may be required before you head into the scanner for an MRI is for us to just do a download, because the only risk is not that we will damage the device, but we might wipe your data clean. So for example, if you haven't had a download for some days, then having an MRI might mean you lose those days' data. But essentially, if you've been having daily downloads and you've not been notified of any untoward rhythm abnormalities, it's usually quite safe to go ahead and do the MRI scan. So there are different places that we can implant your loop recorder. So this is the loop recorder. The most conventional place, and where we like to place it the most, is somewhere here. So 45 degrees just off your breastbone on the left-hand side, where it goes and sits 45 degrees overlying your heart. So that's position number 1, which is the most common position we like to see. The second position, depending on the size of your breast or breast tissue, could be on the third intercostal space. Again, just adjacent to your breastbone, where we implant it more horizontally, and here is where it might sit. The third position in which we might attempt to do, and this is particularly if, for example, you're skinny or you want to avoid a visible scar, is underneath your left breast. And so just around here, we go horizontally across underneath of your left breast. But this may risk for the people who are wearing a bra, it will risk being touched or compressed by your bra line, depending on what kind of bra you wear. So it's not a position we would start off with, but it's subject to discussion with your implanting team.